Hi, you guys. Welcome back for our daily practice questions. It is day 127. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And make sure you hit that subscribe button so you're not missing any of my notifications and videos and upcoming posts. Now, also, you guys, I'm not sure if you have seen, but for Nurses Week and in celebration of my birthday, there are some deals out. So if you are looking to join the membership where you have access to my tools and a forum with me and the ability to ask questions and to have our monthly topics, tips, and some Q Bank access, click the birthday link. It is $38 per month for those founding members. And then for Nurses Week, we have a BOGO buy one, get one on one-on-one sessions. So you buy one-on-one session for $149 and get the second one free. So the links are under the post section if you're looking, but I'll also add it in the description if you're interested in any of those deals for the week. All right, you guys, question number one states, which of the following scenarios best represents a breach of patient confidentiality by a nurse practitioner? Is it A, sharing a patient lab results with the consulting cardiologist? Is it B, discussing a patient's diagnosis with the billing staff? Is it C, answering a patient's spouse's question about care without consent? Or is it D, documenting clinical findings in the patient's chart? Take a moment and tell me what you got. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem is the question, and the question is the stem. Which of the following scenarios best represents a breach of patient confidentiality by a nurse practitioner? And the best answer is C. Answering a patient's spouse's questions about care without consent is actually breach of confidentiality. You have to ask the patient, even though it's a spouse, you have to ask and clarify if they're okay with us sharing any information, as well as if they're calling for anything. You have to have consent. So going ahead and getting that up front typically covers you in most cases. Okay. You can share the labs with people who are consulted on services. Billing staff needs the diagnosis for the diagnosis codes to bill. And of course, documenting a chart is not breach of confidentiality. So C is your best answer. Question number two. Which part of Medicare typically covers outpatient nurse practitioner visits and medically necessary services like diagnostic tests? Is it Part A, Part B, Part C, or Part D? Take a moment and tell me what you got, y'all. All right, STEM is the question. Question is the STEM here, y'all. So which part of Medicare typically covers your outpatient nurse practitioner visits and the services like diagnostic tests? And the best answer is B. Medicare Part B covers your basic outpatient needs, okay? And then lastly, question number three. To bill Incident 2 under Medicare, which of the following conditions must be met? Is it A, the nurse practitioner must perform the initial patient visit? Is it B, the supervising physician must be physically present in the building? Is it C, the nurse practitioner must bill under their own MPI? Or is it D, the patient must be hospitalized? Take a moment and tell me what you got, y'all. All right, so states to bill Incident 2 under Medicare, which of the following conditions must be met? And your best answer is B. The supervising physician must be physically present in the building if you're billing Incident 2. Okay. It can't be that the nurse practitioner must perform the initial patient visit. When you're doing Incident 2, The supervising physician does that first initial consultation, and the nurse practitioner can do the follow-ups if the supervising physician is in the building, okay? So just make sure you know those the criteria. All right, you guys, I hope you found this helpful. We have been navigating through our non-clinical information so that you can get an idea of how these things in terms and policies and research models may be presented, and showing you how to apply it to the question format. So I hope you're finding this helpful. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.